Hello, everyone, and welcome to today's webinar on Halaxy Telehealth, which is our new video tool built right into Halaxy. Now, before we get started, we're just going to give everyone a minute or so to join the webinar. In the meantime, please feel free to introduce yourselves in the chat. Tell us where you're from, what sort of practice you're working with, and I'll introduce the team and we'll get started in just under a minute or so. All right, so let me just change slides and we'll go over what we're talking about today. So my name is Key. I'll be presenting today. I'm here with my colleague, Michael. So say hello, Michael. You on the line? Do we have you there, Michael?
Hi, Key. How are you going today?
Good to hear you, Michael. Thought we lost you there for a second. No, it's good to hear you. We also have Isabella in the chat. So she'll be there helping answer any questions you have in the chat. So if you have any questions along the way, please do enter a message in the chat. Isabella and Michael will be there to answer, but we also will have a quick Q&A session at the end. So where we can answer any questions live. So here's what we're going over today. So Halaxy Telehealth is a new inbuilt feature that we have that allows you to just run video consultations directly from Halaxy. It's going to be the easiest to use video consultation tool you've ever seen, I promise, and we're really excited to tell you about it. We're also just going to go over the pricing options available for it, as well as the other options you have available in Halaxy for video consultations. Now, if you're attending this webinar, chances are you've already used something like CoView or Zoom or Skype with Halaxy. Those options aren't going away. We're all about giving you more flexibility here. Halaxy Telehealth is a new option that we think you'll be quite impressed with, but those other options are here to stay also. We're also going to go over how to track your Halaxy credit usage, so you can see exactly how much you're spending on Halaxy Telehealth, and how to create custom telehealth specific reminders, which will be automatically handled for you. Okay, so if you just give me a moment, I'm just going to change my screens over to the Halaxy calendar. So bear with me. Okay, everyone, you should now see my Halaxy calendar on the screen. And if you have any issues with any audio or video connection, please just say in the chat and we'll be able to help you out there. There is also a reconnect button at the top if you have any connection issues there, and we'll be able to sort it out. All right, so the great thing about Halaxy Telehealth is that it's already enabled for you and built directly into Halaxy. There is no sign up, no registration. It's just all ready to go. And we're going to show you that right now. But what we're going to do is I'm going to create a test appointment with my co-host Michael as a test patient. And we're just going to show you exactly how the telehealth feature works. So let's just create an appointment now. I'm just going to click to create an appointment on my calendar as usual. Now I've added Michael to my patient list, so I'm just going to choose him. Sorry, I didn't select him properly. There we go. I'm just going to add a Medicare fee. And this is all you need to do to create a Halaxy Telehealth appointment. In this location drop-down menu, normally it'll be set to your physical address. So let me just scroll down quickly. Sorry, I don't have a proper mouse today. Now, if you've been using online consultations with Halaxy, you're probably familiar with selecting this online consultation option here. With the new Halaxy Telehealth feature, all you do instead is click this. Set it to Halaxy Telehealth and then click Save. And just like that, we have set up a Halaxy Telehealth appointment. Now, give me 1 second. I really should set the time to about 10 minutes later, just because That's what it needs to be. Sorry, give me a second. Sorry, I'm just having all these pop-ups come up. I need to get rid of them. There we go. All right. So as you can see, just by saving that location to Halaxy Telehealth, there is now in the appointment information panel this blue link that says Halaxy Telehealth. And to join the video session, all we need to do is click that link. Now, Michael, as the patient, would have already received the link to join the session as a patient. But if for some reason we need to send it to him again, it's super easy to do. All we do is click on this email link icon. So if we click on that, and as you can see, there is already an example, a sample email set up with all the appointment information on it, as well as a link that Michael can use to join the session. And that link will work on whatever device Michael is using, whether it's a computer, an iPad, a phone, or if it works with Halaxy Telehealth. So let's just click this link and show you exactly what the video session looks like. All right. So when you click the link, what you get now is a pop-up which shows you an estimated credit cost. So Halaxy Telehealth costs 2 Halaxy credits per 15-minute block per patient. Now you can have as many as 3 patients per session. So that's 4 participants total, including yourself. And the way you do that is just by adding extra patients to the appointment if you need more than 1 patient. So this is an estimated cost based on how long the appointment duration is estimated to be. Again, it's 2 credits per patient per 15-minute block, and we won't actually be charged until we click to start the consultation in the next screen. So let's just do that now. And once I click this button, I'll be able to set up my microphone and webcam. The telehealth link appears in a new tab. And as you can see, it's already detected my webcam. If I need, I can change my webcam and microphone settings. At this point, you have not been charged anything, so you get a chance to configure your webcam and microphone before anything happens. Now, your time begins when you click this join button. And as you can see, it's already figured out Michael was the patient. So I'm just going to click to join the webcam, the teleconference session. And Michael, if you could join in just a second, that would be great. All right, I'm just going to mute myself there so you don't hear me twice. And hello, Michael. How are you doing?
Hello, Key. It's great to be here with you.
Everything coming in crisp and clear on your end?
Fantastic. You look brilliant.
Yeah, so do you. Thank you. So this is the Halaxy Telehealth video screen. This is what it looks like when you've just got 1 patient on the line. If you've got 2 or 3 patients, it'll change so that you can see everyone at once. Now, we can't see on the left, we've got Michael. His name is in white, which means he's joined. It would be grayed out if he hadn't joined yet. We can see, his webcam and microphone settings. We've just muted ourselves so that we're not coming through twice, but ordinarily that wouldn't be crossed out. And this is it, basically. Your telehealth session is in this tab here. If you need to access clinical notes during the session, you can just click back to your original tab and then click the clinical notes button and then enter notes as you go. So this is a seamless experience for your patient. The video is still going in the background. You'll be able to have a conversation as you type. Now, we are working on a change so that you can access the clinical notes on the same screen as the video, but that's not ready in this first release. So for the moment, there's nothing wrong with just using your clinical notes in another tab. All right, well, hopefully that gives you an idea of just how easy this is. I might click disconnect, Michael, and we'll just go on.
Great consultation, Keith.
Yeah, thank you for attending this telehealth consultation with me.
That's very easy.
Yeah, I'm glad. All right. So as you can see, we've got controls to mute your webcam, your microphone, and to disconnect the call here. Now, it is important you click to disconnect the call because that's when Halaxy calculates the time blocks of how much you should be charged. So I'm just going to do that now. So see you, Michael. Thanks for joining. And the link expires at this point, so you can't access it after the fact. So I'm just going to go back to my Halaxy calendar. Now, based on the time that I clicked that join button to the time that I clicked the disconnect button, that's how long it would have charged. That's how long it would have calculated the appointment was, and therefore how much to charge. So as I said earlier, you are charged 2 credits per patient per 15-minute block, and that's calculated at the end of the call once you click disconnect. And you are allowed to go into negative credits for that. So even if you have a very low number of credits, you won't get disconnected during the call. It'll be calculated afterwards. Now, I'm just going to very quickly show you how to track your Halaxy credit usage so you can see exactly how much you're spending on Halaxy Telehealth. And the way you do that is by going Reports and then Finance. And we're going to create a new report. And then in the report type field, we're just going to choose the Halaxy credit usage report. So I'm going to select that. And then we're going to click Run. Now you can filter by different add-ons if you like. We don't need to do that for now. And as you can see, I've made 2 telehealth appointments today. I used 2 credits for each of them. And if I have, you get a summary at the top showing you the totals as well. So very easy to track how much you're using. A reminder that Halaxy credits cost as little as 15 cents. So this is a fantastically cheap option. And I just want to reiterate again that this is already available to you. There is no sign up or extra hidden cost aside from that credit cost. And all you need to do is when you're creating an appointment, change the location to Halaxy Telehealth. And if you want to use those other options, the online consultation option is still there. So a reminder that if you are using something like CoView or Zoom or Skype, if you still want to use those options, all you need to do is click this online consultation option here. However, the advantage of using Halaxy Telehealth, aside from just being super easy to use, is that you don't need to fiddle around with stuff like finding the right Zoom link and giving your patients, the correct Zoom password or anything like that. As soon as you click this Halaxy Telehealth option, it's all sorted out for you. Now, I mentioned earlier that Michael already received the link to the session. So the question is, how did he do that? Well, the answer is through the Halaxy Reminders system. Michael would have already received that reminder as soon as I created the appointment because of how well reminders are set up, and he would have received a specific telehealth link in that reminder. So let's have a quick look at how we set that up. I'm going to click Settings and then Reminders. So as you can see, I've got my Halaxy set up so that Michael gets an email whenever I create a new appointment, and then we've got the pre-appointment reminders set up here too, which is, you can see that here. If you need to change those, you just click Edit, and then you can select or unselect the checkboxes as you need. Cancel out of that. Now, the important thing here is that, as you can see on the right, this is where we edit the wording of the reminders in the copy section. We've got a couple of categories here. In the top, these reminders here, these are the reminders we use for our face-to-face appointments at our physical address. However, we've also got this category here for video consultation appointments, and that's this allows you to have separate wording for your online consultation reminders. Now, the way that Halaxy figures this out is based on that location drop-down menu that we edited earlier. If you have it set to a physical address, it will use these top reminders here. If you have it set to Halaxy Telehealth or online consultation, it will use the video consultation reminders. So let's edit the wording of these reminders and see what they look like. So right now, we've got our pre-appointment video consultation reminder selected. And as you can see, it specifically mentions that this is an online consultation and that you can join the video session by clicking this link here, video consult link. Now, if we have a look at our face-to-face reminders, we wouldn't have set that up. Yeah, it doesn't say anything about online consultations. So you can edit the wording of your face-to-face and your video reminders separately. Just going to go back to the video reminders. Now, this video consult link dynamic term in square brackets, this is what the patient will actually click on to access the video session. That's the link that Michael would have clicked on. And to add that to your SMS reminders, you just place the cursor where you want to put the link, and then you click this button here. And as you can see, it's added the video consult link again. Now it's duplicated here, so I'm just going to delete that. But that's how you would enter the link in, and that will become the link once you actually send out the reminder. For editing the email reminders, it's very much the same process. So as you can see here, the video reminder talks about joining the video session here, and it's got that same dynamic term. But to add it to the email reminder, we need to click this dynamic terms button. We need to search for the video one. There it is, video consult link. And we just select that. And as you can see, it's been added to my template. Now, again, these reminders only go out when you set the location of the appointment to online consultation or Halaxy Telehealth. So I'm just going to save those reminders now. And I'm going to show you how you can review exactly what the patient sees. So I'm going to go back to my calendar. One second. Sorry, it's just taking a second. There we go. And then I'm going to click on that appointment again. And I'm going to click this bell icon here, which lets you see exactly what reminders went out for this appointment. It's because it's already happened, it won't let me change new ones. But what I'll do is I'll just create a new appointment so you can see what that looks like. Going to add a Medicare fee again. And I'm going to set the location to Halaxy Telehealth so I can show you what the links look like. Click on the bell icon. And then if you hover your magnifying glass over these reminders, you can see exactly what was sent out. And as you can see, there is a clickable link for Michael to have clicked on. He can join the video session just by clicking that link. And again, Halaxy Telehealth works whether you're using an iPad, a phone, a desktop computer. It will all be compatible. All right. So what I want to do now is I just want to have a look at the chat and see if there have been any questions. Marg has asked if there will be a recording of this webinar. Yes, there will be a recording, and that will be made available tomorrow, most likely. So you can have them review this at any time. And again, I'll just go over the options for Halaxy Telehealth. So let me go back to my calendar. And again, so you don't need to sign up for Halaxy Telehealth as a service or anything like that. If you have a Halaxy account, this is already available to you. And all you need to do is click this location button and set it to Halaxy Telehealth. And just like that, you'll have a Halaxy Telehealth appointment ready to go, automatically set up. All your patients need to do is click a link. All you need to do is click that blue link here. You click on the appointment to get the appointment information panel up, and then that link will be clickable and you can set up your session there. You won't be able to start the session until it's nearly time for your appointment to start. And that's just so you don't accidentally start the session at the wrong time and get charged for no reason. Again, Halaxy Telehealth costs 2 credits per patient for 15 minutes. And if you wanted to add more patients to an appointment, so you can get, say, 3 people in the appointment, you just click add another patient here. And then if I add, say, another patient there, I'll add Sarah Abrams, and then I'll save that. You can now see that there are 2 patients as part of this telehealth appointment, and each of them will have a unique link to join the session. So if I click on that one, I can send Sarah her link, and if I click on the one above, I can send the link to Michael. All right, so I'm hoping that sort of shows you sort of how easy this is to use. Again, there is no subscription fee or anything like that. The only charge we have for Halaxy Telehealth is the credit charge that I mentioned earlier. And there's no fiddling around in the Zoom links or anything like that. You don't need to pay a monthly fee. If you still want to use CoView or Zoom or Skype, those options are still available to you, and all you need to do is set the location to online consultation instead of Halaxy Telehealth. Now, Halaxy Telehealth is secure. It's protected by all the same security that Halaxy is protected by. So that's bank grade encryption, tokenization of every payment details, everything like that. So there's no issue in terms of security. It is suitable as a health platform. You don't need any special equipment other than a standard microphone and camera. And again, once you join the Halaxy Telehealth screen, you'll be given a screen where you can set all that stuff up. All you and your patients need to do is click to allow your browser to use your webcam and camera, and you're good to go. All right. So I'm hoping that answers any questions we have available. But is there anyone who has any particular questions they would like to ask? I'll be able to answer them live now. All right. So again, this is already available to you. So you could go home right now and create a telehealth appointment for 5 minutes from now. So I've just gotten a question from Michael. And okay, so there is a question here. Can it be used on a mobile or any device? Yes, it can. You can use Halaxy Telehealth anywhere. Again, it's all part of the Halaxy cloud. So it is available anywhere you have an internet connection and does work on any device. All you need is a webcam or a microphone. Does it have a subscription? No, you only pay for what you use. So that's the other advantage of Halaxy Telehealth. So if you want to use CoView or something like that, that option is still available to you through Halaxy. However, CoView does charge a monthly fee. With Halaxy Telehealth, you're only going to pay for what you use. So again, payment is calculated based on how long the appointment is. It's charged in 15-minute blocks, which is calculated at the end of the session. Now, in the instance where you have, let's say, 3 patients invited to your Halaxy Telehealth appointment, and 2 of them don't show up, you'll only be charged for 1 patient's worth in that instance. Again, it's calculated 2 credits per 15 minutes per patient. And if 2 patients won't show up, you'll only be charged for the 1 patient. So this is the perfect pay-as-you-go option if you're conducting like a certain number of telehealth appointments per month. So Margus asked, is it possible to screen share or record the sessions? Yep, well, so we'll send out a link to everyone who attended the session today. And yeah, you can feel free to share that link with as many people as you like so everyone can view the session. Or if you've got some screen sharing set up, you can also do that. All right, does anybody else have any questions? Oh, I've asked, so someone's just asked, is it possible to record the video sessions? That is not currently available. However, that is something we are looking at in a future release. So at the moment, you aren't able to record the video sessions themselves. Does that answer your question, Marga? Great. So yeah, screen sharing and recording will be available in the future, just not quite yet. This is an ongoing development. As always, we're always looking for improvements, and we'll be making those along the way. All right, so I hope that answers everyone's questions. Again, this is the perfect option for any kind of practice. To pay-as-you-go option, easiest telehealth system to use. And if you need any further support, There is a support article that you can access on our support website. So if you go to support.halaxy.com and look up Halaxy Telehealth, you will find a support article with all the information you need about pricing, about how to set it up. In the meantime, I encourage you to just go into your Halaxy and have a go. All right. So I think that answers everything. So we might just end the session there. Yeah. Isabella's put the support link in the chat. I hope this has been enlightening, and I hope you all take advantage of Halaxy Telehealth right away. All right. Have a great day, everyone. Goodbye.